Good afternoon, pet parents. I hope you are having a great day. Welcome to our lunchtime break conversation. My name is Tracy Bisson. I'm here with Karen Reilly-Brickett. We're both of It Takes a Village Pet Care. How are you, Karen?
I'm well, thanks. How are you, Tracy?
Good. I appreciate you joining me today.
And thank you for asking me.
Absolutely. Karen and all of her knowledge that she's going to be sharing with people today. I'm very excited to get to this topic. First off, It Takes a Village is a sustainably focused dog walking and vacation pet sitting company. We're located in Barrington, New Hampshire. And over the last several months, primarily due to COVID-19, we have been hosting live conversations like this, as well as in our dog walking club on a number of topics that our clients and our followers have expressed interest in. And this is one that has come up recently in the news that Karen and I wanted to hop on because we feel it's a very important topic. Karen has been going down this rabbit hole here for the last week, trying to get as much information as we can in regards to COVID-19 and is it killing our pets? And the reason we started down this rabbit hole primarily is due to two recent conversations, or news reports, I should say. One that came out from National Geographic in regards to a dog named Buddy that passed away and tested positive for COVID-19. And then another report that just came out last night on ABC News in regards to another dog that tested positive for COVID-19. So I tasked Karen as our safety manager and as a certified instructor for PetTech to look into this further. Karen also has a strong background in human medicine, which she'll tell you about here in a minute. But there is a lot of expertise on this side of the pond here, if you will, with us, and we felt it was our duty to go and explore this information and bring it to you based on what we found. So, Karen, do you want to tell us a little bit about what you do at It Takes a Village Pet Care and your expertise?
I am a pet first aid and CPR instructor for It Takes a Village, certified through PetTech, which is a national corporation. And before I came to work in the animal industry, I was, for 30 years, I was an emergency medical technician. I worked on 911 ambulance services for almost 30 years. And on the ambulance out in the street for 10 of those years. And then working as a dispatcher and then as the manager of a 911 dispatch center. I retired from there and started working for you, and I've really got interested in all of the ways to help protect pets with illnesses and accidents. And surprisingly enough, our pets really reflect what happens in the human world too. With pets, there isn't a whole lot of difference, which really surprised me. But that is my passion.
Well, you've been such a great asset to us in regards to your knowledge and just all of the safety articles that you've written, both for our team and for our clients, just to keep everybody safe, to keep pets safe. And it's really been our goal. You and I have had conversations about this, to be on the leading edge of information as it comes out. And obviously there's so much information on COVID-19 coming out. A lot of it is speculation still. And I think when it comes to pets, there's still so many unknowns. And there are concerns on the part of our clients, on the part of our followers, but also trends that we saw early on when COVID first hit in the United States back in March and April, that pet owners were giving up their pets to rescue facilities because they were concerned that their pets could spread the disease to them. And, Karen and my goal is to educate you based on what we understand so that you can make the best decisions, but also to not act rashly, to, take the information, follow up with your professionals, veterinarians, and other, healthcare providers and pet care providers that you work with to really get, the information that you need before you make a decision. Please do not give up your pets without having the information that you need. So, I feel really good and confident about this information that Karen and I have been researching. And that's what we want to share with you today. And we're also committed to coming back to you as we uncover more information, whether that's daily or weekly or every other week. But, we want to be that resource for people in regards to COVID-19 and their pets. So I think without further ado, Karen, I want to start this off by, having you explain some of the really credible resources that you used to gather your information for our conversation today. Can you just tell us a little bit about that?
Sure. When I read the article from National Geographic, I then went to the CDC page, and that was talking about animals and COVID-19, which with the animals, it's a SARS-CoV-2 is what they've given the disease, but it is the same thing. And from the CDC, I went on to, there's the World Health Organization, or the World Organization for Animal Healthcare. And the acronym is OIE, so it kind of makes no sense, but if you put OIE, that will come up, the World Organization for Animal Health. And what they do is they collate information from veterinarians or anybody else that reports a possible animal infection with COVID-19. I'll just say COVID-19 to make it easier. And what they've done is they've gone through, they do country by country, but they can only do what's reported to either the country's form of CDC, and then that goes to the World Health Organization. They're still working on getting that all together, so it'll be a little more streamlined so that they can get more information. Right now, the information that they have collated is that in different countries, there's only been a couple of animals. There isn't an overwhelming number of animals like there are humans that are coming down with the COVID-19. In every case so far, it has been an animal has been infected from a human that is living in the home with the animal. So, and right now there is no hard evidence, but research is still ongoing. But so far, they have nothing that indicates that the animal can transmit the disease to the human. It's a human to animal transmission.
So why don't you just repeat that, Karen, because that's really, really important.
Right now, there's no hard evidence. Research is ongoing, and that's why we're going to try and stay on top of this. As soon as we come up with any new information, we will get it out to our people here. But no hard evidence that animals transmit the disease to humans. Animals contract the disease from humans, but so far they have not transmitted it to humans.
And did you say there were about 100 studies roughly, or 100 animals that they have been following? Is that what you reported?
Right. Yes, I'm sure that the numbers have increased since you and I have spoken, but they follow the animal from the time that it's first reported as infected, and then they go back and find out what the outcome was, keeping in touch with the veterinary practice that had reported it. And so far, except for the two cases that we saw reported in the United States for the two dogs, none of the other animals have died. Okay. In what I've seen from the report on OIE. It's a little bit, you have to kind of get in there and, really kind of compartmentalize the whole report, but that's what they found so far. And so they have also found
cases of pets that have recovered, correct? They tested positive, but then they recovered? Okay.
Right. And they are showing the antibodies that they have had the COVID-19, and they've recovered from it. Okay. So almost, all the animals from the OIC that I looked at that they have followed have recovered.
Okay. And so I just want to reiterate something else that you said too, that there's no evidence that companion animals transmit COVID-19 to humans or other animals, but there is growing evidence that our pets can contract the disease from COVID positive humans. And that's what happened in the 2 cases that you researched, right, with National Geographic and with ABC News?
Right, yes. Although I do want to tell you that in doing a little more research this morning, going back to the OIE, they have found that cats, ferrets, and minks are more susceptible to COVID-19 than dogs or other animals. Pigs and chickens are not affected whatsoever, and that cats can transmit the disease to other cats.
So you're saying that there's hard evidence that supports that with cats?
Yes, so that's what the OIE is reporting, that cats can transmit to other cats. That's what they've been finding, as well as ferrets to ferrets, minks to minks, but they make no mention of a cross-species contamination.
Okay, so let's back up for just a second. So when we say pets can contract the disease from COVID positive humans, we're saying cats and dogs. We'll talk about domestic animals at the moment. So we're saying that can happen, but in your research, you are seeing that both cats and dogs, there's no evidence to support that either felines or canines have shared the disease with their human companions, correct?
Correct.
Okay.
Correct. None of the reports, in fact, all of the reports strongly emphasize the fact that more research needs to be done. Right. But right now, they have found no cases where pets have transmitted the disease to humans.
Okay. And so you said cats can spread to cats. Is there any evidence that dogs can spread to dogs?
Not that I could find. They made no mention of they just specified the cats, ferrets, and minks. So cats for our companion animals are the only ones so far that they have specified can transmit to other cats. And again, they made no mention at all of cross-species contamination. That doesn't mean that can't occur, but the report that I read, there was no mention of it.
Okay, so now
in the 2 cases that we saw on the one on National Geographic and the one on ABC News, the one on National Geographic was about a German Shepherd, a 6-year-old Shepherd named Buddy, who his owner had tested positive for COVID-19, and then a couple of weeks later, the dog started to have some issues, some respiratory issues, coughing and having a little bit of difficulty breathing because of the COVID-19 in the pet's owner. They did a test for Buddy, and he tested positive for COVID-19. During the process of the whole COVID-19 he was trying to recover from, they also found that he had lymphoma. He ended up dying 3 months after he contracted the disease, the COVID-19, but they said before he died, he tested negative for COVID-19, and the lymphoma is what they're attributing his death to. But the COVID-19 obviously, could have affected,
exaggerated the
exactly
complications.
Right. So he already was in a weakened state. They just didn't realize he had lymphoma at the time. And then they found it in the process of treating him for the COVID-19.
And so in that case too, I think they showed that the owner had COVID-19 first. There was concrete evidence to show that the owner had it first, and then the dog contracted from the owner.
Right, correct.
Okay.
And both the owner and the dog ended up becoming negative.
Okay.
But like I said, and as with the humans, if any human has an underlying medical condition, the COVID-19 is much more dangerous for them than for a healthy human. And I'm seeing evidence that it's, it could be the same with pets. But right now, they don't mention anything in the reports about an underlying medical issue for the animals.
Well, how about with the story that came out last night from ABC News, the dog in North Carolina? So now, did that dog pass?
They said, yes, the dog did die,
Okay.
and they don't cite in that short report, they don't cite an underlying medical condition. They also said that at first the owner or somebody in the house with the pet tested positive for COVID-19, but then their test came back negative on further testing. It doesn't really make a whole lot of sense. Somebody had, this animal got it from somewhere.
Yeah. Okay. So again, in that second case, the human had COVID first, and the theory is that it was spread to the dog from the human.
Right.
Okay.
Right.
Okay.
Yeah.
Let's see. In regards to the World Organization for Animal Health, let's see. There's some information here that you shared with me. Let's see. Yeah, so, and you mentioned this earlier. It says, in every instance so far, the animal was living with or interacting with a human who was known to have tested positive first. The majority of these animals, ones with no severe underlying medical conditions, survived the virus and eventually tested negative. So there are reports that are supporting animals being tested with COVID and then testing negative. So, and I don't know, I don't think you mentioned this to me before, but of the reports that you looked at, were there more discussions about the pets that had passed? I mean, the only two we really know of is from National Geographic and ABC News. Were there other pets mentioned in your research that showed other pets had passed as well?
No, actually, in the OIE, the World Health, they specifically have a chart, and it shows how many animals in this area were reported as positive, and then what the outcome was, which is they end up becoming negative, and it'll say, number of deaths, and in all those columns, it's been 0. But that's just in the reported cases.
Right.
There could be, a lot of other cases out there that don't end up getting reported right away or reported correctly. So they can only go on the information that they have.
Well, and what I find interesting too, and I don't know if you found this with both studies, but I know study on the dog named Buddy, the owners did a necropsy and they offered the samples to an organization, wasn't it, for testing? But
they had offered, right? They had offered to their vet. They had offered to have a necrotic study done, which is just a study of the dead tissue of the animal to see what they could find out. And at the time, there was nobody interested in looking into that, which I guess they were quite surprised about. So and that was actually just in July, just last month, but it could have been their state was overwhelmed. I can't remember what state they were in. So, and I know right now the focus is all on human COVID-19 cases. So that might have, caused them to say, no, we're going to have to wait a bit. We've got all these other cases that are human cases that we have to get through first. So, they didn't do any.
But you mentioned that the World Health Organization and the World Organization for Animals, they're working closely together. Is that correct?
I'm sorry, the what organization?
The World Health Organization for Humans and the Organization for Animals, they're both working kind of in tandem?
Yes. Right, yes. In one of the reports that I read at OIE, they are working with the WHO to try and see where this, progression is going to go. And then maybe what can come up with, dogs are now have antibodies, so these animals that have had it and recovered, same as the humans, now they have the antibodies against it. So I'm hoping that with that information, they can even start to develop a vaccine for our domestic animals to try and keep them from contracting the disease, but obviously that is going to be much further behind the vaccine that they're going to come up with for humans.
Right, because there's no evidence of that yet, correct?
No, but I'm thinking because the OIE mentioned it, that would be the next logical step. And that's why I said I'm hoping that that is what they'll end up doing, and I can't imagine that they won't eventually
We'll
come
keep
up
on
with.
that too. So yeah, I know you'll let me know if you see any mention of additional studies on that. Okay.
Yeah, I'm going to be checking the OIE website every couple of days to see what else has come up. Just in the couple of days since I started investigating, they started mentioning more animals that were contracting the disease, but still, even though they've come up with more animals that are contracting it, they haven't found any evidence that the animals had it first and then the humans. It's always been humans first, then the animals that were interacting with those humans contracted it.
Okay. Well, let's talk about some of the symptoms to look for if you think your pet has COVID-19. What are some of the symptoms that they're displaying that pet owners can be on the lookout for?
Like with humans, they would have be running a fever. They'd show signs of coughing or difficulty breathing, sneezing. They would be very tired, very lethargic, wouldn't be their normal selves at all. They might have some nasal discharge, and they might even have some discharge from their eyes. So if and you can't just take one of these things and say, oh my God, is this, it would be a number of them together that, would raise some concern. And they might even have vomiting and diarrhea, but usually the vomiting and diarrhea goes along with a fever or respiratory issues, and then they'll have the vomiting and the diarrhea. And not all cases show all of these signs. Some of them just show a couple.
Right.
So like in the case with Buddy, he just started showing with coughing and having some respiratory problems. And that's what led them to bring him to the vet to begin with.
Right.
And then because, and when they got to the vet, because the owner was COVID-19 positive, that's what led their veterinarian to test the animal for it.
Yeah, so I think that's really important for everybody to remember is that if you have any concerns about your pet's health, your next best step is to call your veterinarian and have a conversation, especially if someone in your house has tested positive or has found out they've been around somebody who has tested positive and they themselves are waiting for a test. So I think that's a really important conversation to have with your veterinarian for sure.
Right.
Well, and Karen, I know that you had mentioned, now just switching quickly from domestic pets, you had mentioned there are some other types of pets in zoos that have been testing positive.
Right. In a couple of the zoos in the United States, they've got some tigers and lions that have tested positive. Again, part of the cat family, they are more susceptible. And in those cases, they found that one of the handlers of the cats was COVID-19 positive, was just asymptomatic at the time, didn't realize that they were COVID-19 positive, and transmitted it to the cats.
And do we know, are those lions still alive?
Yes. So none of the tigers or lions. They haven't mentioned that, or if they did, I don't remember. But I do know that they are all alive, and they at last report they were doing well.
Okay. Mm-hmm. Okay. Well, let's talk about if you have been around, you as a pet owner have been around someone who has tested positive and you are waiting for a test to come back. What should these pet owners be doing to keep their pets safe while they're trying to determine if they're COVID positive?
Well, they should definitely use protective precautions. Wear a mask around your animal if you are the only caretaker. If you are not the only caretaker in the house, the person who is waiting for results should try and stay away from their companion animals as much as possible. Don't let the animal lick you, especially in the face. Don't interact face to face with the animal. Have a mask on. Wash your hands before feeding and after feeding your pet. A lot of hand washing and kind of a keeping away from the pet, maybe just housing yourself in or the pet in one room of the house so that you can cut down interactions with that pet, and that will help keep the pet from contracting the disease. It will help keep them, but it won't guarantee that they won't get the disease.
Yeah, and I think, when we say, limit interactions with your pet, that's very, very hard to do.
Right.
But
I know.
since we're not entirely sure, and based on the research we have, we're not entirely sure how pet owners spread it to their pets. Do we have any hard evidence that suggests it's the same way that humans spread it to other humans?
Nothing has been mentioned about, I guess it's just an assumption that
Right.
You're going to assume it's the same way that humans spread it to other humans.
Yeah.
With surface contact. I mean, really the best thing you could do for your pet is if you can have somebody else come in and take care of your pet while you quarantine yourself away from that pet. If you're the only one in the house, or you're worried that other members of the house may also test positive, if you can get your pet to somebody else, another family member or a best friend. Again, they shouldn't worry too much about the pet transmitting it to a friend or a family member. It can happen, but right now it has not happened. And that way the pet is out of the house altogether. If the pet doesn't have an underlying medical condition, it appears that healthy pets that contract this, as with healthy humans, they seem to get through it. Their symptoms can go from almost nothing, just a cough here and there, to the other end of the spectrum where they have severe difficulty breathing. You may not even know that your pet contracted the disease, but
Right.
they could still come up as positive.
Yep, exactly. So I think too, if you know yourself that you have tested positive, or potentially if you're in a high risk group, maybe you are a senior or you have some other kind of underlying health condition that puts you at a greater risk. Let's talk, Karen, about some of the plans you should put in place. For instance, I want to talk about a pet preparedness plan, and I want to let everybody know that we do have Christine Calabrese coming up with us in September, who actually has written a book here called What About the Dog? She also has written one called What About the Cat? And basically it is a preparedness plan for your pet. And the book takes you through all of these things that you need to consider, things you need to put in place, conversations you need to have with your pet care professionals. But she's going to be coming up with us live in another month, and I'll tie these videos together because she's got some really great systems and processes in place to help pet owners as they prepare for the decision of, what do I do with my pet if something were to happen to me, or if it's just in the interim and I need to go to the hospital, or I'm just too sick to take care of my pet. We want to help pet owners to prepare for this ahead of time so that they have that plan in place. So we're going to definitely keep on this with you. But what are some other things that people should do if they know they've tested COVID positive?
Well, the ASPCA also mentioned the preparedness for somebody else to take over the care of your pet if you're too sick or if you end up going into the hospital. And are you talking about what should they think about as far as the preparedness?
Yeah, that, and I know a lot of the ways that you would help to protect your pet from yourself if you're positive is much the same way if you think you're positive. Limiting close contact with your pets, washing your hands regularly, wearing a face mask. But any additional information that maybe you saw or research that would help pet owners prepare for if that becomes inevitable and they have to really consider what's next for their pets?
Yeah, well, as I mentioned, the ASPCA also has, I believe, a list on what you should consider when you're preparing to have somebody else take care of your pet. Obviously, any medications that they have, you want to gather their specific food. Talk to their veterinarian and let the veterinarian know that, you know, this so-and-so will be taking care of my pet. They have my permission to have the pet treated for anything that comes up. Make sure the pet has anything that makes them comfortable, their beds or blankies, their toys, especially if they're going to somebody else's house. If somebody is coming into the pet's home, say the pet parent is at the hospital, then they definitely want to make sure to protect themselves first with a mask, and make sure that they clean any areas they're going to be touching first, you know, with sprays that will kill bacteria and other types of diseases, and just washing your hands.
Yeah.
Especially if you're going to interact with the pet. That pet really needs interaction at this point, and you just want to make sure that you wash your hands a lot before and after. Before, so that you don't end up inadvertently transmitting the disease to the pet if you don't realize that you're not positive, or if you've touched other surfaces, if you've interacted with the person before they went into the hospital, you have to consider that you may have also contracted the disease, and you want to keep that pet safe. But just getting all of their stuff together, making sure that there's somebody that you know that is very responsible and has agreed to take care of this pet for you and all that it entails. That's the most important thing.
Great, that's good advice, and we'll be reporting more to pet owners as we uncover different processes, different systems. I mean, I know it's a little bit scary because if you have a pet care provider who's going to come in and take care of your pets, you know, they're potentially also at risk. So there's just so many moving parts to this equation that we need to look out for. So, you know, as we get more advice from experts out there in the field, like I said, Christine will be coming up with us later next month, and she'll be talking about the things that she's researched and the experts that she's talked to come up with a preparedness plan for your pets, and we'll be bringing that information to you. So I think, like I mentioned in the beginning, Karen and I will be reporting on information as we hear new news reports, as we uncover additional research. Karen has tapped into some great organizations, as we mentioned, that are very credible and coming out with information, and we'll bring it to you in a timely fashion. And in the interim, if you are seeing this broadcast on the replay, and if you have questions, you can feel free to email us directly. We will answer questions in future broadcasts as well. And, you know, any questions, any concerns that you have, we want to be a resource to people. We really want to take this concern under our wings and just flesh it out for everybody. We're very passionate about it as well. Karen and I, obviously, we own multiple pets and we take care of our clients' pets. So by us being, you know, on the leading edge of what's happening here, we can give peace of mind to our clients so that they know we're doing everything possible, one, to report the good information, and two, to keep their pets and their families and their homes safe. So Karen, I appreciate all the time that you took to, you know, go down these rabbit holes. There'll be more rabbit holes to come up as we move forward, but you know, we'll bring it to our pet owners here as we get more information. So I appreciate your time, Karen. Have a great day, and we'll be back with everybody potentially next week. All right. Have a great day, everybody.
Take care.